Okay, so Gabriel, I'll pass on the mic to you. I think we can start, and then people can join in, later.
Okay.
Yeah.
Okay. So good evening, everyone, and thank you all for joining our first North America exam seminar. And today we have two amazing speakers. Our very own Dr. Kenneth Iyamo. Dr. Kenneth is an internist, did internal medicine at Harlem Hospital here in New York City, and now works in Florida. And also we have another speaker from New York, Mrs. Lisa Ronco. Lisa is a dietitian at Lincoln Hospital where I work, and they'll be speaking about um, uh, how the topic today is going to be um, adopting health practices for optimum wellness. So we're actually trying to make it an interactive conversation. So if you have any question along while they're speaking, you can always type your questions on the box, or if you want, you could raise your hand and then we'll call you so you can ask your question. You know, I'm gonna hand over the mic now to Dr. Kenneth to give a brief introduction of himself, and then Miss Lisa also could do the same after Dr. Kenneth. Dr. Kenneth.
Okay.
Thank you so much, Dr. Cyril. Thank you, Lisa. Thank you, everybody. Just let me try share my slides here. Let's see. I'll do that. Okay, I do have the slides open. Who is a tech person who can let me know how to share the slides? I have them on Google Slides.
Yeah, so do you have the host?
Yes.
Okay, so let me transfer.
Sure. Okay.
Let's see.
Do I just put share? Do I click on share slides?
Yes, share.
Okay, so share. Okay. This says with which group? Let's see. Add people or groups.
No. So share screen. No, it's you click on share screen.
Okay, let's see.
Yeah, just on the bottom. Yeah.
From the bottom. Let's see. Bottom. Share screen, or do I just put to play the slides? Let's see. Is it share and export?
No, you just when you click on share screen, you see the windows that are open, and then you can click on where your slide is. Yes.
Share screen. Okay.
That's if you have your slide open already, you see where your slide is, and then you can.
It says, present on this device, correct?
Yes.
Yeah.
Okay, let's see. Present on this device. Okay, let's load in. Okay. Let's see. Present. Let me say, click on present to a meeting or meeting ID.
Okay. Okay, can you email me your slides?
Okay, let's do that here. Okay.
Yeah, I'll play it from my side.
Okay, so that will be share and export, or just share. Okay, let me just click share, then I'll put it to your email. Okay.
Okay.
And what's the email? What's the email?
Kingsley. I'll send it to you via. I'll just chat. I'll just send it to you on the chat.
Okay. All right.
Yeah.
I'm sorry. Yeah.
Once I get it, I'll just open it from here and then share my screen.
Certainly.
Yeah. And once you start out, the meeting will be recorded so that we can post it for people who couldn't attend. Yeah.
Sure. Yeah. While you're doing that, I have to apologize. I was on call today, so it was kind of like a little delay in my getting home. So I ought to have signed up about 5-10 minutes prior. Yeah.
No problem. Patience first. And thank you everyone for joining. We're just trying to set up the presentation and we'll start in a minute.
While you're doing that, you can also give me the email. I can type it in. Kingsley.
Okay, yeah. So it's KING SLEY at Huron.ai, HURONE.ai.
Kingsley at.
Yeah, Kingsley at Huron.ai, HURONE.ai.
Okay. .ai. Okay, Kingsley at Huron.ai, right?
Yes.
Okay, all right, let's do that. Okay, just let me know if you when you got it.
Okay. Yeah, I have it now.
Okay, all right.
So I'll just open it from my end and then share.
Okay.
Just give me 1 second.
Sure.
Okay, good. So, okay, so let me share my screen. Just let me know when you want it in the next slide. Once I set it up, and I will do that. Okay, so welcome everyone. The introductions have been made. So it's our very own Dr. Iyamo.
Okay, all right.
Yeah, Dr. Iyamo, you can take it on.
Right.
Yeah.
All right. Okay. So thank you so much, everybody. Again, apologies for the little hitch. I'm AFMS 81/AFMS 81/182. So from the most famous Purple Squadron, which is the Champion Squadron. I know some people might have reservations about my saying that, but
no, we do.
Keep the reservations to yourself. All right. Okay. So I'm talking about health and wellness. I think this is a very broad topic, and it's a very poignant topic. And to be able to distill as much as possible all the information within a 20-minute period could really be a big task. But I'll just try to speak to the major components of this topic. And if there are questions that I haven't really, if there are issues I haven't really alluded to at the end of the talk with my colleague, Lisa, then we'll be able to see how we can shed more light into them. So with the WHO, WHO defines wellness, health as a state of complete physical, mental, social well-being, and not merely the absence of disease. And of course, defines wellness as the optimal state of health of individuals and groups, as expressed by a positive approach to living. I will look at it as though, say, health being the destination and wellness being the route that you take, the daily choices that we do make, the daily positive choices that we do make with a view to getting us to that state of optimal wellness. All right, so I'll just go to the next slide. All right, again, expanding more on health and wellness. Optimal health being the goal, and wellness being choices that we do make with a view to accomplishing this optimal state of good health. It's really difficult to obtain health as a goal without adopting strategies that point us towards wellness. And as the presentation goes by, we'll be able to understand the reason why I'm saying this. Whatever we do on the long run ultimately affects our overall state of health. As we can see, health wellness is really multifactorial in the sense that it does encompass physical, mental, intellectual, and other forms of our health. And to be able to ultimately live a happy and robust life, it's very important that we take steps with a view to addressing the individual components of wellness. Health, as I say, comprises of a state of health. If a patient is well, you say, okay, patient is healthy. If a patient has any illness that negatively impacts the patient's health, you call that as a state of being unwell, or a state in which a disease entity is being diagnosed, be it lung disease or heart disease or thereabout. And what we do is that things that negatively affect our health can ultimately come as a result of injuries from either injuries from various negative choices that we do make, or it could be familiar. There are situations in which people are born into a family in which there are some abnormal genetic abnormalities, which in the optimal environment ultimately goes a long way with the genetic makeup of the human being. Interacting with negative components in the environment may ultimately lead to expression of disease states. Next slide, please. I also just go ahead to indicate that this process of growth is an active process. Either making positive or negative choices deemed to be active processes. There's really no point in which there's a standstill in our health. There are situations, there are factors that do go a long way in either pointing us in the right or in the wrong directions. There are factors that do affect our health and wellness. These factors include factors like actively pursuing activities, whether they are physical or mental or otherwise, making positive choices, lifestyle changes, controlling risk factors that are out there, risk factors that could go a long way in harming in a negative way the human health. There's also the need to focus on a balanced nutrition. Lisa is going to speak in depth about it. Also, following spiritual practices, that ultimately lead to holistic health. We have to be proactive, be intentional in what we do, especially when we come to making choices as to whether positive or negative choices that may ultimately affect our health. Ultimately, the responsibility is ours. I think we live kind of in a system whereby the system, does not, for the most part, ascribe responsibilities to individuals. I speak from the view of the practice where I work. I work primarily in the hospital. I do hospital medicine. You can have people who have, over the years, made very negative choices. Say, for example, smoking. Maybe ultimately they have their lungs burnt out, they come to the hospital, it's either, okay, we have to blame the tobacco company, or blame somebody else, there's always that situation whereby the primary responsibility of people's health are not necessarily ascribed to them. At some point, we all have to take responsibilities for actions that we carry out, with a view to either negatively or in a positive way affecting our health. As I said earlier, health and wellness really is multi-dimensional, and it carries a lot of a holistic undertone to it. Several aspects of health and wellness, as I said, physical, intellectual, emotional, social, spiritual, environmental, occupational. I will just speak to, I'll probably just start with the physical part of our health, or physical things that we do that affect our health and wellness. Exercise, there's really a lot that's been, if you try to search it as to what's the optimal way in which we should engage in exercise, that will, on the long run, improve our health, I'm sure you're going to see a wide range of exercises, whether indoors or outdoors, in terms of exercise, you have situations in which range from just simple walking, even more of just power walking, to jogging, it's really a wide range spectrum. I'm sure some of us have come across situations whereby, for people who do keep track as to how many steps they take on a daily basis, you get to some places where they say, well, okay, 10,000 steps a day is really the optimal goal in this regards, I've also seen also other sources that would say, well, even up to 8,000 steps might really do it. And some studies have also even showed that incremental steps, incremental in the sense of saying, even taking about 500 steps, incremental steps of 500 steps daily, 500 steps might not even be up to 1,000 steps on a daily basis, has that beneficial effect to our health. So to whatever extent somebody is really to exercise, either you go for power walking, or whether you're jogging, or you are at your place of work, going from the first floor to the 7th floor, if you intend to say, just make a conscious choice to skip taking the elevator, even just your decision to walk up the staircase, or you go to the shop, instead of you parking your car just in front of the shop and walking directly into the shop. If you park just a little further away from the entrance of your store, or say your place of work, and just the 200 or 200 steps that you ultimately take walking into the store and back, I think we really can overemphasize the importance of adequate physical exercise to whatever extent that you're able to do as your health does permit. Okay, coming to the intellectual dimension of wellness, the idea of being able to learn something, even if it's just reading, make conscious decisions as to reading articles that do interest you, reading a book, problem solving, even something as mundane as, say, doing crossword puzzles. These are things that are very important for those who have creative minds. This overall go a long way in enhancing our intellectual wellness. Emotional wellness also encompasses having a feeling of good self-esteem about yourself. It's not really about what people tell you about yourself. You have to, first have a good self-esteem, be happy as to where you are. You ultimately, irrespective of your as to whether you're a Black person or you're a white person, just be comfortable in your skin. People may tell you whatever they need to tell you, but if you ultimately have that good sense of well-being, this is something that goes a long way. Being able to empathize with other situations that people go through, rejoicing with those who rejoice. If there are situations in which people have some challenges in life, be there, being able to console them, as the case may be. So talking in terms of the social dimension, this is also a very wide spectrum. It can range from relating to loved ones, being able to interact with friends, contributing positively to the community. Can you, in whatever way you think you can lift people up, volunteer your time, volunteer your time as to things that you feel are important to you. Ultimately, being able to balance, to strike that delicate balance between work and family is really something that is very important. I'm sure the healthcare, like so many other professions, the burnout rate can really be high if you are not able to really walk that thin line, being able to balance your work with the relationship we have with family, friends. Spiritually, people, they have those who believe in God, or whatever your spiritual inclination, it's very important to have that notion that there is the higher being than you. It's not just about you dropped from the sky. There's a purpose for your being in this earth, and to whatever extent you can, being able to accomplish that purpose for which you currently still living. People can come along your path, hurt you in whatever way, being able to forgive and having compassion on people who are less privileged. These modalities that go a long way, in enhancing spiritual well-being. Environmental well-being also encompasses how can we, on our own part, cater for nature. 1 second, please. 1 second, please.
So I know Dr. Kenneth was on call today. I know he probably got a call from the hospital. So just give him a minute or two. I think he just rejoined back.
And that's the reality of just stepping out from the call.
And I think he's muted. I don't know if he's talking, but he's muted.
No, because he's responding to King.
I'm sorry, it was mute. Yeah, I'm sorry. Yeah, okay. I'll just move on to the next slide, please. Okay, all right. The next slide tells us about some of the risk factors that would negatively impact our health, ranging from smoking, lung disease, heart disease, alcohol, causing liver disease, engaging in unprotected sexual activities, increasing our risk for sexually transmitted disease, and extreme physical sports, especially in the hot day, ranging from dehydration to injuries like muscle injuries or fractures of bones. These are things that we need to consider as factors that could affect our state of well-being or health. Next slide, please. Okay, all right. I'll just go to periodic health exams and try to emphasize these exams. It's not, some people say, well, if it's not broken, let's not try to fix it. But they say prevention, an ounce of prevention, is what, I mean, several, in terms of weight, several on this, or in terms of cure, in the sense that diseases, when they start early, if you go a long way in adapting health measures with a view to catering for these illnesses when they're still in a mild state, they go a long way in preventing complications, which ultimately may not be reversible if the disease process is allowed to fester for a long while. Part of the things that ought to be dealt with periodic health exams would just be, if you go ahead to meet the doctor, the doctor tries to get a lot of information about you, how old are you? If you come in just like a regular screen, you already have things. It tries to get information as to what is your family history. Do you have a situation whereby family members have died of heart disease, especially maybe at an early age? Or do you have family members who have a history of cancer, either in the male relatives or female history? This is history that is very important in getting an idea as to how to put everything in your context. Reproductive history, for female colleagues, how many children have you had? When was the last menstrual period? Menstrual history, the regular flow, heavy flow, medications. Do you take medications ranging from multivitamins to other medications, blood pressure medications, diabetic medications? And then the doctor goes ahead to do just more like a general physical exam, head to toe, listening to your heart, listening to your lungs. And the provider may ultimately go ahead to do just some regular tests, maybe just a complete blood count, or kidney function test, liver function test. If there are any abnormalities, they point to you as to say, okay, this could be abnormal, then we can go ahead and further investigate these abnormalities. The provider also might go ahead and check your blood pressure, see what your blood pressure is. This normal for you, or is this high for you? Being able to assess your weight, your weight over your height, and go to what they call the body mass index to see whether your weight is normal or if you are obese. The benefit of this health exam is the fact that early diagnosis and treatment goes a long way in reducing the negative health effects, morbidity, and the risk of death as time goes on. There's an argument that there could be some drawback in these health exams, in the sense that if you find something that is abnormal, it kind of sets the ball rolling for you to initiate further testing. Most of these exams may not really be as cheap as you think it is. For people who have insurance, they have co-payments that they have to make. So if you have somebody who is already challenged financially, having to now engage in further testing, whereas the patient is apparently still well at that time, the person may not really see the need to spend more money in that regards. Of course, there could be incidental findings that may not really impact the person's health as we speak. But if these are not dealt with down the line, they ultimately may brew into a worse diagnosis as the time goes by. Now, several organizations that have a lot of guidelines as to screening and so on, the Choosing Wisely campaign, the U.S. Preventive Services Task Force, Canadian Task Force. These are several organizations that put out papers recommending age-appropriate screening measures. Next slide, please. Okay, common screening methods common screenings are really recommended, could fall under varying categories of primary, secondary, tertiary. I think for the purpose of this talk, we're mainly talking about primary prevention and secondary prevention. Primary prevention, which includes like the annual influenza vaccination, COVID-19 vaccination, and for people who have like heart disease, diabetes, and so on, pneumococcal vaccination. The secondary prevention, talking about screening for colorectal cancer, breast cancers, and so on. Next slide, please. Okay. For any screening test to really be very important. You have to look at the disease condition. It has to be a disease condition that has an asymptomatic duration, asymptomatic in the sense that the patient comes in, does not have any symptoms. But if a screening measure is instituted in this patient and you're able to diagnose like an illness, say like a cancer, it should be a situation whereby this cancer is one that if diagnosed early and early intervention instituted, it goes a long way in halting the morbidity that the patient has to go through, or ultimately reduces the risk of death in such a patient. Okay. For the screening test to really be acceptable, one, it has to be at the right price, safe, accessible, and hopefully having very few false positivities and negativities. Next slide, please. Common screening measures that are really recommended, I'll just dwell primarily on adults. I have just about 5 minutes. Depression in all adolescents, 12 to 18 years of age, and all adults or pregnant women or in the women who are in the postpartum state. Diabetes mellitus, from the age of 35 to 70. How can diabetes be screened for? Just by either by fasting blood sugar, or there's a test they call the hemoglobin A1C. It's very important to know what your cholesterol level is. We've talked about the need to have your blood pressures checked. We've also spoken to the need to refrain from tobacco and substance abuse. And lastly, intimate partner violence in women of childbearing age need to be screened for. If there are any red flags, appropriate social services should be informed. Next slide, please. All right, age-appropriate cancer screen, women, cervical cancer, breast cancer. Let's go to prostate and colorectal cancer. So I was told to just put a little more emphasis on these cancers. For prostate cancer, the screening modalities are really controversial. For prostate, the prostate gland is a gland. It's of course is only present in male. It's just a gland that sits at the bottom of the urinary bladder. It encircles the pipe through which you ultimately pass urine. You call the urethra. For the most part, people getting to the age of 50 and thereabout, they are entitled to some increased size of the prostate gland. Just increase in the size, even in the absence of somebody having cancer. For the most part, prostate cancer in the early stages gives you no symptoms whatsoever. If anything, it might just give you a situation whereby you go to use the bathroom and you have a poor stream, you have to strain, or now you see that you have to go after another 5 minutes to empty your bladder, or having to wake up a couple of times into the night. How do you screen for colon cancer? It can range from modalities as just sending a blood test, what they call the PSA, the prostate specific antigen test, or by doing a digital rectal exam in the doctor's office. And if they have any concern based on the levels of the blood or what they find on physical exam, then ultimately they can go ahead to further testing like ultrasound and biopsy. It's recommended for men between the ages of 55 and 69. Prior to this screening being done, it's advisable to have a conversation with the patient as to, okay, this is what we're gonna do. Get the patient's preference. If the patient wants to go ahead, this is very important. In instances in which prostate cancer is diagnosed, it's going to go a long way in influencing as to what you really do, as to whether you decide to treat, or if the decision is not just active surveillance. The issue with prostate cancer is that there's a saying that most people die with prostate cancer as opposed to of prostate cancer. This means that prostate cancer, especially for the majority, the prostate cancer is not really a very aggressive cancer. So even if it is diagnosed, there are situations in which, based on like what the test shows whether it's an aggressive form of cancer or not. If it's a cancer that is not very aggressive, the decision might be made just to say, let's actively survey, meaning let's check your PSA over a period of time and see if it rises, then we can do some more testing. If it's one that is very aggressive, then the decision as to initiating treatment, either hormonal chemotherapy or surgical radiation treatment is there. It's very important to have this conversation. Next slide. Okay. It's not recommended to continue to screen for prostate cancer in patients who are over the age of 70 or who have a life expectancy of 10 to 15 years, because ultimately, as we said, you have to weigh the benefits between screening, one diagnosing, and the decision to treat or not. The last one I'll just talk about is the colorectal cancer. Next slide, please. Next slide. Okay. Okay, colorectal cancer, I think the guidelines are really more well established with colorectal cancer. The thought is that colon cancer develops initially from what they call like a polyp. A polyp is just like an outgrowth of the inner lining of the colon. And it's thought that there's a time lag between a polyp developing and ultimately, like, you check the nature of the polyp as to whether it's abnormal cells on the polyp or you have abnormal cells and ultimately transitioning to cancer. So it's really recommended. Previously, it used to be ages 50 to 75 by the American College of Physicians, but lately it's been found that they end up diagnosing patients who are even younger than the age of 50. So the current screening really is from the age of 45 to 49. The issue is, and again, with like with the prostate cancer, you need to really advise the patient as to, okay, if we get these results, this is the next step. It's not advisable to go ahead to screen people who have a life expectancy of less than 10 years. How do you do the screening? Next slide, please. Next slide. There are very modalities for screening for colon cancer. The most recommended one really is colonoscopy. It's just they prep you to clean you up, and ultimately they put in an endoscope and look through the whole length of the colon to see if there are polyps. If there are any polyps, they go ahead to excise the polyps and take them for pathology. That's the standard. For people who don't want to have colonoscopy, there's the flex sigmoidoscopy, which involves more of just examining up to maybe the first couple of inches of the colon, and then ultimately recommend that the person goes ahead to do a fecal immunochemical test. I'm sure we've seen ads of Cologuard on television. Cologuard is an example of fecal immunochemical testing every 10 years. And of course, lastly, you can do either the fecal testing or also checking for blood in the stool. The immunochemical testing test for the DNA of colon cancer that is positive in the stool. I think, and just lastly, there are people who have a more than average risk of cancers, what they call familial cancer syndromes. This could be people who have first-degree relatives, maybe 2 or 3 first-degree relatives who have had like breast and ovarian cancer. It's also obtainable in patients who have colon cancer. So the screening that we've talked about really is a screening for people who have at average risk. People who have familial cancers, it's recommended for them to speak with specialists in that regards. They may need to initiate testing at a much earlier age, probably even say colon cancer, they may have to initiate screening 10 years before the regular age of screening, say age of 35, they may need genetic testing. All right, so I think that's the end of the slide, and I'll have Lisa go ahead and give her presentation. And at the end of the presentation, I'll be happy to entertain any questions I have not spoken to. Thank you.
Thank you so much, Dr. Ken Iyamo. Thank you so much. That was really brilliant. And yes, we will take questions. So just keep your questions, or you can write them in the chat. We'll take the next speaker, and then we'll have a Q&A after this. Lisa, over to you. Thank you.
You have my slides, correct?
Yes. Let me get that set up. 1 second.
So thank you, everybody. We're gonna a little bit about myself. I'm the director of ambulatory nutrition at Lincoln Hospital, and thank you, Cyril, for inviting me to speak to you all tonight. So what I'm gonna do is I'm gonna piggyback on a little bit more about definitely more about the nutrition component of health and wellness. And in my practice and personally, I believe in looking at a person mentally, physically, and spiritually. And so tonight we're going to talk about what is a healthy diet. Oops, my little typo. Next slide. So a healthy diet means eating foods that promote health. And there are 5 main food groups that contribute to a healthy diet. And these 5 food groups are in every culture. And so they're adaptable to every culture. We want to make sure that when we're choosing foods, because food and exercise are one of the few things we have a choice over in life. So if we make the best choices, 99% of the time, those little extra things can fit in. And personally, I don't believe there's any good food or bad food. I think there's good choices and better. So let's move to the next slide. So what does a healthy diet mean? So when someone tells me I just want to eat healthy, that can mean so many things to so many different people. What a healthy diet means to me could be something totally different than what it means to Cyril. So these are the 5 food groups that we're going to focus on. And these are necessary. So protein, starches, non-starchy veggies, your fruits, and healthy fats. There's no single correct way to eat. I would be doing a patient a disservice if I told them you could never eat rice. Or you must eat your broccoli if they hate those foods, right? Okay, next. So each person's, we can back up for a second. Each person's nutrition needs are going to be a little bit different based on their anthropometrics, their physical activity. So we look at that as a dietitian when I'm recommending a certain amount of calories to a patient, which I never do. I never tell them exactly what I think this is how much you should be eating, because it's kind of a guesstimate, right? So we look at balanced meals. What I like about this picture is it just shows you a variety of ways across different cultures how we can get these nutrients in different packages. Next. I don't know if you guys ate dinner yet, but if not, you're probably going to be getting hungry. So what is protein? Protein is important to all parts of the body. It's the building blocks of our organs, muscles, and bones. And making sure to get enough protein every day helps maintain those muscles. Protein comes from animal foods and plant foods as well. And plant foods tend to be less expensive and a little bit better for the environment. So let's look at some different sources. Beans and lentils, nuts and seeds, tofu and soy, cheese, eggs, milk and yogurt, chicken and turkey, or poultry, fish and seafood. Sources to limit. So red meat, beef and pork, and processed meats. I was reading a study yesterday, and it's recommended. I wouldn't say recommended, but they said eating red meat increases type 2 diabetes risk 24%, and processed foods, I think it said 46%. So that's something to think about next time you go shopping. So where do starches come from? Starches provide the body with energy, and you'll also know them as carbohydrates. Sometimes they get the bad rap. The energy in carbs comes from the sugar in these foods. We have simple carbohydrates and complex carbohydrates. Starches may increase our blood sugar levels, and they come from grains and starchy veggies. And I want to back that up for a second, because when we say starches may increase your blood sugar levels, whenever we eat, our blood sugar goes up. If we eat, if somebody drinks just juice, for example, your blood sugar is going to go up quicker because there's no fiber, there's no protein, there's no healthy fat. So of course your blood sugar is going to go up quicker. And that's why we give someone who's diabetic orange juice when their blood sugar is low. Next slide. Here's some other examples of starches or carbohydrates. So your grains, I always recommend that someone chooses whole grains instead of processed. So if that means whole grain wheat bread would be a better choice than white bread. Variety of your cereals, rice, oats, barley, couscous, and your starchy veggies. So cassava, corn, peas. Maybe if you haven't ever tried some of these vegetables, I encourage you to do so. Expand your palate. Next slide. Non-starchy veggies, great source of fiber, low in calories. They provide many vitamins and minerals. And so you can tell from the picture, and what I love about it is it's kind of corny, but we're always saying it, eat from the rainbow. And why is that important? Because you have to think the antioxidants, those powerful nutrients, phytochemicals that you're always hearing about, these provide the antioxidants that our body needs to decrease inflammation. So you have to think, how did this eggplant become so purple? That orange, so orange. Those phytonutrients, the flavonols that make garlic and onion so pungent, those are your antioxidants. You want to get a healthy variety of those. So remember, eat from the rainbow. Next. And like I said, each color has different properties, vitamins and minerals, and you can eat them fresh, raw, or cooked. And oftentimes patients will ask me, what's better? Fresh, frozen, canned, they all count. Fresh, if you can. Frozen would be the next best because it goes straight from the farm to the freezer. And canned is good as well. Just make sure you rinse. After you drain the water, make sure you rinse them. Here's some more non-starchy veggies. Again, I kind of encourage you to look at any of these, and if you've never tried any of them, don't be afraid, but maybe it'll help you think, hey, I'm going to try Brussels sprouts. Next. Okay, fruits. Fruits are a great source of fiber, potassium, vitamin C. They all have it, not just bananas with potassium. So again, you want to try and eat from the rainbow. And fruit affects blood sugar levels, of course, right? Because you're eating. Fructose is nature's sugar in fruit. You can eat it raw or cooked. Same thing, fresh, frozen, or canned are good options. However, canned, you want to make sure, or little fruit cups, you want to try and get them in water, not syrup. Dried are good. Just be mindful that when you take the water out of a fruit, there's going to be more sugar content, right? And fruit juice obviously is high in sugar. It doesn't provide the same benefits. So that's something to think about when your patients or your friends or family or you are saying, oh, fruit juice, but where's that fiber? You're not getting the nutrients. Next. Again, some different varieties. And again, I encourage you to try something that you haven't tried before. Next. Healthy fats. They mostly come from plant sources. So think about healthy fats that you might have in your diet right now. And that picture shows us a great variety. They could lower the risk of certain diseases. They provide nutrients that our body needs. They add flavor and mouthfeel, right? So that's why there's a difference when sometimes patients will say, I don't like skim milk because it's too watery, because fat provides that mouthfeel, that creaminess that we like. And the fat-soluble vitamins, fat helps our body absorb them. So it's important to include at each meal. So you can see there's salmon, there's avocados, different nuts and seeds. Next. Again, and we can get our healthy fats from a variety of food sources: seeds, nuts, olives, vegetable oils. Next. So what is a healthy meal? So we're going to start with breakfast. So a balanced breakfast has at least 2 food groups. So remember that, right? Protein and a starch. So I want you to start to think about what you had for breakfast today, what you had for lunch, what you had for dinner. How did you do? There's no quiz. I'm not going to ask you, did you pass? Each food group should take about 25% of the plate. So for a bigger breakfast, you can add the fruit or non-starchy veggies. Next. So these are some examples, right? You have your oatmeal. There's my whole grain. I've got milk and I got walnuts. So my walnuts are going to be some protein in there. Blueberries, right? Eggs and mango with sauteed spinach. So I'm getting 2 of those there, right? If I have whole grain toast, peanut butter, and apple. So I've got my protein and my starches here, right? Next. Balanced lunches and dinners have at least 3 food groups. So again, think about what you had for lunch and dinner. Hopefully you didn't skip one of those. Again, it's the same. They should be about 25% of the plate is protein. The other quarter is carbs, and the other half of the plate is non-starchy veggies or salads. So if you or someone is asking what is a healthy portion, this is really what this plate, if you will, is showing. That's a balanced plate. So if I take my plate and I divide it in half of it should be my non-starchy veggies and salads. Quarter, the other half, divide that in half. I've got a quarter is protein and starch. If someone is trying to reduce their weight a little bit, I kind of use the plate as a clock, and I would say make your non-starchy veggies and your salads up to the 7 o'clock position, and then you're going to split the rest of the plate with your protein and starch because those are equally as important. Next. So here's some examples, right? Salmon, there's my healthy omega-3s, mashed potatoes, roast asparagus, spinach, and tomato salad. And there's a great example of a lunch or a dinner. And notice how, hopefully you all are noticing, but look at that color, right? Like how boring would it be to look at a plate and if I had all white food? I have white turkey, white mashed potatoes, white piece of bread. That's boring. You wouldn't dress like that, so you wouldn't want to eat like that. Snacks can be optional for most people. I think they serve a purpose depending on your activity level. Again, we want to try and make healthy choices, right? They can help you eat enough during the day if you don't have enough time or if you don't have the resources to have a balanced breakfast, let's say, then a snack would fit in there. For folks my patients that are diabetic, we recommend to keep that blood sugar consistent, eating a little something something every 4 hours. So that's where snacks can come in. You just want to be mindful that if you're eating a balanced breakfast, lunch, and dinner, you don't necessarily need a snack. But if you want that snack, try and cut back a little bit at a different meal so that the snack doesn't take you over your calorie needs for the day. Next. Again, in healthy snacks, these are the food components. You get your protein, starches, fruits, non-starchy veggies. And they combine at least 2 when you think of your snacks. So again, I want you to start thinking, what do I normally snack on? If I'm thinking of my husband, it's like potato chips. Next. These are some examples of healthy snacks. I can see the brains going on over there. That's not what I eat. Okay, so let's practice. These are some examples, right, again, of healthy snacks. Next. Okay, fruit, oatmeal. How many, is this balanced? What do y'all think? Now, something that is nice, they combine these all together, right, and they made a shake. If you're somebody that doesn't have a lot of time, you could try overnight oats, which is a good thing. You can make a yogurt parfait. So I think part of the problem sometimes people say that I'll give you 2 examples. Folks always say to me, am eating healthy is too expensive. No. Or I don't have time to eat healthy. What does that mean? We all have the same 24 hours in a day. And it's more about, to me, it's more about being mindful about your time management. So think about that. Next. So that meal, the rice and beans, for example, if you took out the pork chops, right? Like if you wanted to have a more plant-based meal, you don't need the pork chops because the rice and beans together make a complete protein. And having said that, if somebody is trying to lean a little bit more towards eating less animal food, if you ate, let's say you ate oatmeal at breakfast and then you had black bean soup, you don't need to eat the grain and the lentil or the bean at the same meal. As long as they're eaten at this in the day, that's okay. You're going to get your complete protein. That's a nice colorful plate. Balanced breakfast, at least two food groups, protein and starch, like we saw with the oatmeal and the walnuts. And you can combine them all. You should at least eat two fruits a day. So I always like to tell folks you should try and get at least a combination of a colorful five. So if you think a serving size of a fresh vegetable like salad, that's a cup. If it's a cooked vegetable, you need a half. So that's really easy to get. And then, so maybe one day you could have three veggies, two fruits, three fruits, two veggies. It's up to you, but try and get those in every day. Next, healthy fats. Okay, so this time the question's on you guys. What one or two changes do you think you could start making?
Okay, well, thank you so much,
Oh, you're
Lisa.
welcome. You're
Yeah,
welcome.
um, I'm sure a lot of people that were watching were like, because a lot of our meals, traditional Nigerian meals, are a little different, and to be very interesting to see how the Q&A, because I know a lot of people will have questions. And so I think without further ado, this is a good time for a Q&A, and there's already a question from Lisa, and so we can type in the chat, or you could just raise your hand or just unmute yourself and ask, pose your questions to either Lisa, or Dr. Ken. I'll stop sharing this slide for a second so I can get a grasp of who is sending in questions. I can see lots of messages already. Okay. Okay, so let me just take the questions on the chat, and then folks can unmute. So the first is, can I blend cornflakes? This is from Kalu Aja, Oga Kalu as we call him. Add color to your rice. Can I blend cornflakes? Maybe Oga Kalu, you should expatiate on your question, or if it's a comment.
Yeah, what I'm just asking is, I know I take fiber, the fiber breakfast, all those whole wheat and all that. And I thought it was pretty fast if I just blend it and drink it instead of like eating it. My friend says, no, it's fiber. You're supposed to eat it. It helps with your gut. So I'm just asking, can I actually blend it? Do I get the same benefits if I drink it, or I have to eat it with the milk and all that? That's really what I'm going to.
You're not, so would it be like bran flakes or corn flakes?
Yeah, like bran flakes, all that stuff that they do, like all those healthy wheats.
Absolutely. So you're just changing the consistency, right? You're not juicing it. And that's kind of an example. So if I'm just juicing, and then what do you do with the pulp? The fiber, that's where you're going to get the satiety. You're going to get the nutrients and the fiber. You're just changing the consistency. So no problem. If you want to throw that all in the blender, your bran flakes and whatever you mix it with, it's still going to go in. It's still fiber. It's just pureed.
Okay, and
Yeah, that helps a lot. Yeah, thanks so much.
Sure.
Yeah, thank you. The next question is no more kush and dosh for breakfast, it seems. So I'll explain to you what that means. So
Please, what is it?
So we have a meal in Nigeria where you take beans and then you blend it into like liquid and then you fry it. You put some, salt and pepper and other things, and then you fry it. And then you fry like sweet potatoes. So it's a very popular breakfast meal where you have like the fried beans, blended beans and sweet potatoes. And that's all starchy. So I think the question is to comment on that, if that is a breakfast that should be continued or should be modified to qualify as healthy.
So it's interesting because I've never had kosh and dosh, but what comes to mind, I'm trying to, Dr. Google and see if I can find a picture. Have you ever all eaten like
Lisa, it's like the fried dumplings.
Okay.
Yeah, it's like fried dumplings. I don't know if you've ever had fried dumplings before. There's something like that, but instead of the flour, what we do is we blend the black eyed pea beans, and then we season that up, and then we fry them.
What do you fry them in?
In oil.
In veggie oil.
Deep fried?
Yeah, deep fried, yes.
Can you air fry them? No. No, right? No. I would say sparingly, right? Think of it like fried chicken. I'm not going to go to Kentucky Fried Chicken every day. If you had it a small portion, remember, I don't want to be the food police. Every once in a while, that would be okay. My question to you, I was thinking, as soon as you said that, I'm thinking, do you know what scallion pancakes are that you get in like an Asian restaurant? They're fried and there's like scallions in there. I'm wondering, and you all would be the experts, could you add vegetables to this? So instead of being all starch, you're going to get the protein from the beans, but could you add some vegetables to it? Or would that change it?
I think I can answer for the group. No, you can't add vegetables to it.
Yeah.
But only if you want to have it with vegetables, it has to be separate. Yeah. So you can't add vegetables to it.
So you would eat the kosh and dosh just by itself?
Yes, and there's some people would add another level of starch, which is called pap. And basically what pap is a meal made with corn, and it's kind of like custard by the time it's done. So it's a lot of carbs and lots of starch. So I think the key message here is to make the food colorful and have at least some dose of veggies.
Yes, and also what I want to add to that, again, not to be the food police, if that was the only fried meal you had that day, that's good. And the second thing is if you're kind of carb loading early in the day, like that's your breakfast, then you have to think, what did I not get at lunch and at breakfast that I need at lunch and dinner, right? So I didn't get any fruits, I didn't get any non-starchy veggies, that sort of thing. So you can, at the end of the day, say, hey, I got my 5 fruits and veggies, protein. Interesting.
So before I go to the next question, I have a question, and my question is to Dr. Eyamo. So from your presentation, obviously it's kind of complicated to know it's a discussion that one will have with your physician when to do prostate cancer screening. Is it because of the possible overdiagnosis to just do a PSA, or because, I mean, the risk for Black men is much higher than other ethnicities. So how do you approach when to start, because a lot of people on the call are, above 40 or nearing 40. So what would be your key advice in screening? Because I mean, it's always best when you catch it early, since it's something that is very high risk for, Black men.
You're right. Yes. Thanks for that question. As you said, yes, Black men are at a higher risk to the general population of developing prostate cancer. Certainly from the age of 55 years of age recommended, especially if you have a strong thing. The issue is this screening is quite simple, just going ahead with the blood test, the PSA, is something they draw your blood and within a day or two, they get the results. Secondarily, the exam is something that is also quite simple. I mean, they said not many men. I did hear that in terms of age-appropriate cancer screening, most women, they man up the more in terms of age-appropriate cancer screening for women as opposed to men, as to maybe one, because of the nature of the exam, in which either you lie on the table or you stand up, bend over, and the provider behind you with the gloved finger goes ahead to examine the prostate. So it's recommended from around the age of 55 or thereabout, but then for me, I'm not 55 yet.
Okay.
But I just feel maybe on a once or twice yearly blood test that I do, I just ask them, well, to my knowledge, I don't have a family history of that, but then it's important to start at that point. The issue really is diagnosing is one. Of course, what do you do if your test becomes positive? That is another. Certainly for somebody who has an elevated PSA, there's no question that it's good to follow up with the physical exam and have the doctor examine. And if they feel they're able to feel any rough areas while doing the digital rectal exam, go ahead and take a biopsy. Diagnosing is one, especially for the fact that if the diagnosis is made, especially by the biopsy, they'll be able to tell you as to whether it's kind of like a low grade, which is like a kind of a good cancer, in which the prognosis is quite good, or a high grade. For those who have a low grade cancer, then you may not necessarily need to have any treatment. It might just be worth the while doing what they call the active surveillance. Yes, there could be the over-diagnosis in terms of any kind of screening. That's always a problem that the provider does face. Once the over-diagnosis, if you just diagnose it, it makes people more apprehensive when they say, oh, you're having a diagnosis of, say, prostate cancer. Then you ask the doctor, how do I go ahead to treat it? And the doctor tells you, okay, well, given all that we can see, the grade of the cancer and so on, and for the fact that it's kind of localized to the prostate, it's probably wise just say, and just to go ahead and do nothing. That's really a situation that could be uncomfortable for several people. Hence the importance to really have a good discussion as to what to do if in the likely event that the test comes out positive.
Okay, thank you. And Lisa, this question is to you, and it's from Oga Adams-Ayo. What do you think about intermittent fasting for weight loss and 6 packs? I believe that was a question. 6 packs.
6 packets or 6 hours?
Sorry, Oga, can you expatiate on your question?
Does he mean hours or?
Oh no, I meant, sorry. Good evening. I meant 6 packs, like abs.
Oh.
Oh yeah, that one.
Do you have 6 packs or you want 6 pack? So intermittent fasting. It's if I had $1 for every time someone asked me that, my student loans would be paid off. I look at it in a couple different ways, right? So if you think about what long before intermittent fasting became a trend, if you will, it's what we did normally, right? You stopped eating at a certain time, you went to bed, you slept, you woke up the next morning, and then you broke your fast. That's why it's called breakfast. So when we start to play around with the time, I've seen it work very, very well for people. It depends on, how extreme, if you will, you're willing to do it. So if I stop eating at 6 o'clock and then I don't start eating again, so you have a small amount of time to get those nutrients in. In a similar way, but more extreme, if people tell me, well, I only eat one meal a day because I'm trying to lose weight, that's a lot of pressure on that one meal to get all those vitamins and minerals in and the nutrients that I need. And our body can only absorb so much at once. So if, for example, you stopped eating at 8 o'clock and the next time you're going to break that fast, and people play around with time. I've seen it. I'll only eat 6 hours during the day, or I'll stretch that out to 8 hours. It depends on the person, depends on the situation. I wouldn't say if somebody was diabetic, I wouldn't recommend that. My question to you would be, are you doing this right now? If so, have you seen any different changes? Like, what are you doing different? You know what I mean?
Well,
Have you tried this? Is
yeah,
this what you
I'm
do now?
doing it. I'm doing it right now. I started at the beginning of the year, and thankfully, I've not broke that resolution. So fingers crossed. But in any case, like I do 12:30 to 8:30. So my last meal for the day must be before 8:30. Which is
Okay.
not a stretch because I mean I typically don't take breakfast, so I take my first meal sometime between 12:30, and then possibly just have one more meal before 8:30 and call it a day.
Are you in those hours that you're eating, based on what we just went over in those slides, are you getting your nutrients in that time frame?
Uh, not exactly. Close, but not exactly.
So that maybe that's something that you could tweak, right? Because we cannot eat better. Just because I'm a dietitian doesn't mean I'm a saint and I eat perfectly every day. No way. Life happens. But if it helps jumpstart you into making those small changes that end up becoming habits, and they continue on, and that works for you, then keep it going. Yeah. And then you'll show us your 6 packs in a month.
Yeah, I'm just not seeing results. It's kind of disappointing.
Well, that comes back to what the doctor was saying, physical activity, right? It's like someone could be um, exercising every day, but they're eating, crap. Or someone could be eating really healthy every day and they sit on their butt. So you need to combine the two in some capacity. You can
Okay,
do
I
it.
I have a question for you before I go to the next person. I have a question for you and Dr. Ken.
Yes, please.
So one of the things that is that is very dominant in our diet, the Nigerian and also the West African diet, is palm oil. And I know you didn't mention it because it's not something you probably come across routinely. But there's just a lot of like debate around like how healthy palm oil is. And if it's I'll just love both of you to comment on it because I think it would be beneficial to the rest of the group.
Yeah, I don't really have anything to say about that. I have to be plain with you. I'm not really in a position to speak to the health benefit of palm oil. I do not know if Lisa is able to speak to that.
Okay.
In terms of, if you talk of oils here in general, not necessarily palm oil, polyunsaturated fatty oils that have high levels of polyunsaturated fatty acids in general are deemed to be healthier options, as opposed to saturated fatty acids. as to what component of, as to how much you have polyunsaturated fatty acids in palm oil as opposed to saturated fatty acids. I think the dietitian will be able to speak more to that. I'm sorry. Yeah.
Palm oil is higher in saturated fat. So that's having said that, if I would encourage all of you, if you're not a label reader right now, is to next time you do your shopping, make sure you're reading your labels. That's the only way you're going to know what's in that. So I'll give you an example. Any of you all snack on chips? I'm sure you do. So a lot of times someone will get a big bag of chips, right? So on any label, and I know you all know this, but just to remind you, so when you look on any label, the first thing it's going to do is tell you the calories. And then it's going to break down all your nutrients, and it's going to start with fat, and it's going to do your total fat, your saturated fat, your trans, and then your unsaturated. It's going to break those down. Then it goes to carbs and protein. That is all for one serving. So sometimes people might eat the whole bag of chips, and it might be small, or it might be half of it air. But is that one serving size? No. So it's important to know that all that information on the label is for one serving size. So don't forget that.
Okay. I think Cyril has a question.
Okay.
Yes, hi. So I have two questions, actually. One for Dr. Kenneth. So Dr. Kenneth, in recent years, we've seen an increase in prostate cancer generally, prostate cancer in male and breast cancer in female in young adults, 40s, 30s. Is there a reason to why we're seeing the increase in cancer in early ages? Is it because we're doing more screening, or is it because the cancers are becoming more aggressive?
Yeah, thank you. A great question. I think one, it really might be as a result of early screening, but of course, say for prostate cancer, I said it's usually presents with no symptoms. If you do not screen for it, you ultimately are not able to diagnose it. As a matter of fact, they say if all men, if they live long enough, that almost over 80% of them ultimately might develop some form of prostate cancer. That's why I said, for the most part, most men ultimately die with, as opposed to dying as a result of the effects of prostate cancer. So I think the fact that you have more people with prostate cancer being diagnosed, I think is just for accessibility and the ease of screening. Of course, diagnosing it is one, as to if this is a cancer. This is, for the most part, this is a cancer that might not ultimately have any negative impacts on the person's health, and the person ultimately might die of other health-related causes as opposed to dying of prostate cancer. I want to say, well, for the breast cancer also, I think the increased awareness, is also there, and of course in this country, they have strong lobby groups, breast cancer survivors and so on. So you have people who have had breast cancer who have been treated. Breast cancer, the diagnosis of breast cancer, they say now, is no more really like a death sentence for women. So you have people who maybe they were diagnosed and ultimately they get treated, they become free of cancer. Of course, some have recurrence of their cancer and so on. For there's the concept of the issue of the familial cancers. There's this issue of breast cancer, familial cancers, in which they may be related to the BRCA, the breast and ovarian cancer genes that have been inherited. If you have, say, a lady who has a history of cancer and has a history of cancer in about 2 or 3 other first-degree relatives, maybe the mother or the sister, that is really suspect. That is a patient who doctors will ultimately suggest that they go ahead to do the genetic testing, the BRCA1 and BRCA2, to see if they have a predisposition or if they have that gene. Is a patient who ultimately might be advised as to doing what they need to do with a view to preventing that cancer being diagnosed, because they are at very high risk. There are some patients who ultimately, if they have such genes, may be recommended that they have prophylactic mastectomy, like Angelina Jolie. Obviously, she did have a bilateral mastectomy, or prophylactic surgery removing the ovaries. Of course, for somebody who has, for a lady who has had a child before, maybe 1 or 2 children, that patient is more open to saying, if I take ovaries out because of my history of having genetic predisposition to it. That's a hard sell for a lady who has not had any child in the past. So I think to a large extent, it might just be as a result of easy access and more screening. Thank you.
Thank you, Dr. Ken.
So my second question is, I know there's more questions coming in. My second question is, I'm not sure if it's Dr. Ken or Lisa that could answer this. So I am 5'5", and my BMI is like almost 40. And each time I exercise, right? And each time I do mainly weightlifting. And each time I lift weight to build more muscle mass, and I go to see my doctor, my BMI is off the wazoo. How accurate is the BMI compared? How accurate is the BMI in regards to my well-being? I know they'll always say you need to lose weight, so your BMI will be between 27, I think, or no more than 27, but mine is like almost 40. How accurate is that BMI? Is this something I should be worried about, or should I stop lifting weight and just run instead? Or what would you guys advise me to do? Thank you.
Thank you. Lisa, do you want to speak to that, or you want me to go ahead?
I think we both can. Do you want to go first?
Okay. You can go ahead first, then I can also speak to you. Okay, maybe I can do. Oh, go ahead, please. Go ahead.
I kind of have a love-hate relationship with the BMI chart, because it can give us, correct me if I'm wrong, doctor, this is what I think I hear from patients and my own, what the BMI tells us is a person's risk for certain diseases. Is that how you look at it when you're telling somebody what their BMI is? Like, my question to the doctors always, what do you want me to do about that?
Sure. So in terms of BMI, yes, a ratio of the patient's weight over the patient's height. The BMI is over 30, says your patient is obese. Patient BMI is over 40, technically that's a morbid obesity. The issue with BMI is that it doesn't really, weighing somebody, it doesn't really distinguish as to whether this is muscle weight or fat weight.
Exactly.
There are some scales that there are some scales that can give you, if you step on the scale, it gives you the proportion of your body weight that is fat, proportion of the body weight that is muscle weight, whether also heavy bones.
It's telling me how much my organs, my bones, my fluid, all this weighs. The other thing that I would challenge you all to think about this, but when you see 2 people walking down the street and one is living in a larger body and one is living in, I guess, a normal or what someone would think is normal sized body, which one would you say is the healthier person?
I'm sorry, I didn't get the question. If somebody is living,
if you see 2 people walking down the street, and one is living in a larger body, and one is living in a normal sized body, who's the healthier person?
There's no need to know.
Well, again,
you can't say really who's the healthier.
It's a loaded.
Exactly.
No.
Just
you don't know because
surface.
You don't know
from
if
the surface, say in terms of the BMI one, okay, what is the patient?
Well, you don't know if the person living in a larger body, maybe they're the one who are eating balanced meals every day and they're the one working out, whereas the thinner person, maybe maybe they are dealing with an illness, or maybe they're a chain smoker and they eat like crap, but we can't make that judgment. So Cyril, I would say for you, if you're doing what you know you need to be doing, you're physically engaged every day. I think there needs to be a balance between weight bearing exercise and cardiovascular, and to mix that up. And then if you're eating balanced meals most of the time, you're already in the right direction. If you don't like your current weight and you're working to change it, that's okay. But it sounds like you're doing the right thing.
Okay, so
yeah,
we're kind of past time, but we have
okay.
3 questions that I need us to get in, and then we can call it a day. So we have I'll say Oga Ayodele, maybe if you can unmute and ask your question.
Hi, good evening. So I was wondering about metabolic.
By the way,
is he on the treadmill?
Practicals, yeah.
Yeah.
Discussion.
That's good.
I was wondering about metabolism. As we get older, does our metabolic rate slow down just naturally, or is it more because maybe we're not as active, or what should we do about metabolic rate as we grow older?
Sure. All right. Great question. Before I just speak to this, maybe just one comment on Cyril's question about the BMI. If there's a way your doctor can evaluate your weight and put it on a scale, and that can give you an idea as to, say, a major component of weight, either being from muscle mass or from fat. That tells me more about the health implications. People who are overweight, obviously, perhaps a propensity for some more health illnesses, cardiovascular, diabetes, mellitus, and so on. So that'll be more reliable. So the gentleman's question, yeah, as somebody ages in life, yes, metabolism certainly slows down. The rate at which metabolism slows down is individualized. For somebody who still lives an active, as opposed to like a sedentary life, the metabolism for somebody who lives a sedentary life is going to be slower naturally. There are other disease situations that can slow your metabolism down other than just decreasing age. It's good to check the thyroid function. The thyroid function is the gland in the body that is mainly responsible for metabolism. Checking the thyroid function and ensuring that the person's thyroid function is normal is the optimal thing to do. If there's anything to suggest a decrease in the function of the thyroid gland, yes, that person might need the thyroid supplements. On the other hand, the thyroid gland is functioning in a heightened state that can exacerbate metabolism, and that person is going to need medications to treat the high functioning state of the thyroid gland with a view to slowing down the metabolism. Things that can occur, as a result of hypermetabolism may just be rapid increase in calcium loss from the bones, of course, weight loss. In terms of, you might be sitting in a room where everybody's saying where it's cold, but you're sweating, that might be one of the symptoms that might point to the fact that the thyroid gland is functioning at a heightened state. In terms of bowel movement, when maybe people say, okay, I use the bathroom to do number two, maybe once a day. Somebody who has a high metabolic rate might use the bathroom 2-3 times a day. But yes, as the age goes by, metabolism slows down. If you're more active, the rate of the decline is going to be less than somebody who lives a sedentary life.
Okay, thank you, Dr. Ken. 2 questions in succession. So someone wants to know, Chidimaize wants to know if there's a cure to cancer at the moment, and how much sleep time is recommended, and is less sleep, or is there any association or correlation between sleep and Alzheimer's or dementia?
Yeah, okay. Optimal level of hours of sleep. What's the first question again?
First question is there a cure to
the second is, a cure to cancer?
At the moment, yes.
Yeah, okay. Maybe the second question first. Alzheimer's is, in terms of the optimal hours of sleep. You have several references that say, okay, at least 8 hours of sleep. Of course, the younger a person is, the more the number of hours of sleep that are needed, especially children who are still growing. The issue is, as much as the duration of sleep is as important as to how many hours of sleep are optimal, quality in the sense that, say, somebody who works over the night, I know some of us are nocturnal people, say you work over the night and ultimately you go home during the day to sleep. It's really difficult to, irrespective of how many hours you sleep during the day, it's not as restorative as sleep overnight. There's what they call the REM sleep, rapid eye movement and sleep. There are varying phases of sleep that you need to go into, for you to get refreshed. And when you wake up the next day, you're quite energetic to move on. There could be situations in which sleep could be disrupted, either by work or people who use electronic devices, in bed, or people who have they have this kind of a sleep-wake cycle in which ultimately, when they're sleeping, they have like obstruction of the airway, and they have a temporary moment in which they cease to breathe. Ultimately, they ultimately wake up. So it's kind of that in and out of sleep. Ultimately, they don't really have restorative sleep, as a result of which they end up having daytime somnolence. Say they're watching television and maybe discussing with their spouse, and ultimately they drift to sleep. These are patients who ultimately will benefit from being diagnosed to see if they have sleep apnea, and if they need sleeping devices, CPAP, and so on, they should use them. As to the cure of cancer, there are some cancers that carry a very grave diagnosis. There are some cancers that have good diagnosis. We've talked about prostate cancer. Majority of patients who have prostate cancer, the prognosis is good. Prognosis is good. Those who have a high-grade cancer, especially if the cancer has spread from the local organ to adjacent regions, maybe like the bones of the spine or to the lung and so on, of course, the outlook becomes poor. If you diagnose a cancer early and there's no evidence of a spread of that cancer beyond that immediate organ, there's no evidence of spread to the regional lymph nodes, and no evidence of distant spread, the possibility of aiming for cure is there. So each cancer varies. Breast cancer, of course, if they are diagnosed, depends on the size of the mass and so on, the size of the breast, lung. If there are no regional lymph nodes in the axis, in the armpit, or if there's no spread beyond just the mass, these patients can just have removal of the lump, and if the margins of the lump are clear of cancer and there's no evidence of spread to any other organ, the prognosis is very good. So I would say some cancers have good prognosis. You can aim for cure. Some others in which the prognosis, the grade is poor, or if there's evidence of spread, the it's very difficult to ultimately achieve a cure.
All right. Well, thank you so much. Yeah, I think this has been a very, very informative session. I think one final question that I have is organic versus inorganic food. Is it real or is it a mirage, or maybe spending a little more?
No, I mean organic food, there's no pesticides, right? And that's why it costs more money. It's more labor intensive. There's certain foods that if you could buy organic, off the top of my head, I can't remember the 12, but there's like 12, like strawberries, for example. But if you can't afford organic, it's the way that you clean them, right? So if you can use a little tiny, like a tablespoon of vinegar and water, and make sure they're very well cleaned, then it's okay. I'd rather say eat non-organic than no fruit or vegetable. And it's also what you can afford.
Well, thank you so much. I think this has been a very informative session. Thank you so much, Dr. Ken and Lisa, for your time. I know you could be using this time to do other things, but you honored the invitation. And I just want to, as an association, we want to thank you for sharing your knowledge and expertise to improve our health and wellness as we drive into the year. And I just want to thank everyone for attending. This has been an awesome session. We have it already recorded, so those who can attend would put it up in our association YouTube. And thank you.
Thank you.